Okay, good morning, everybody. Welcome. Thank you for being here, day two, the summit. I'm very proud and happy to introduce the next panel because this is the people I've been working with for the last 9 months. So I'm really happy to be here with them, joining them. The first person to join us is Michael Quag. Before that, I'm going to tell you that basically we're going to have 10 minutes with each participant. They're going to be explaining the way that their agencies are involved in the Advance Alliance. And at the end, we're going to open the room for questions. Like I mentioned before, for some people who maybe are just arriving, some of the participants are going to be speaking in French. So if you want to run and get some headphones for translations, you can do it through the back door. So let's begin. First person who's going to speak is Michael Quag. He's the Advanced Community Alliance Director. He is part of the community-based research center, and he works out of the CVRC satellite office in Toronto. Michael has worked in community-based research sector since 2004, working on CVRC pilots of Totally Outright in Vancouver, a sexual health leadership program now running in 8 cities across Canada. Michael has also coordinated a variety of research studies and health campaigns engaging gay, bi, queer, and other men who have sex with men.
Great. Thank you, Jose. So I'd like to begin just by acknowledging that we are privileged to be working on and to be gathered here on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, and that our work does extend beyond the lands of these nations. It is my pleasure to be able to provide a broad overview of the Advance Community Alliance, which I think, as folks have already known, has been referenced several times during the summit as the National Alliance or the Gay Men's Alliance. Many in the room are already well aware of some of the important work that has taken place through Advance, such as the strong engagement and collaborations and contributions from Alliance members for the Sex Now data collection effort that took place in 15 cities across the country this past summer. But for those who've been following the news of this alliance since CVRC posted a brief announcement back in March, we know that there's been a lot of interest in hearing more details about this exciting initiative for gay, bi, trans, two-spirit, and queer men's health in Canada. And so we're pleased to finally do this at this year's summit. I'm actually going to try and keep this presentation relatively brief, just to ensure that there's enough time for my colleagues with Advance to speak to the important local and regional work that is taking place across the various sites of implementation, which I'll be reviewing quickly in my presentation. So essentially with this presentation, I just want to provide a brief overview of Advance, and in particular some of the background and history that led to this national or pan-Canadian, as we like to refer it to. And I'd like to share with you the Alliance's vision, mission, and values, which have been an important part and have underpinned the formative development of Advance and guides the thinking of the team in its pursuit to increase access and uptake of combination prevention services among gay, bi, trans, two-spirit, and queer men in Canada. I can't do this presentation without speaking to the team of community-based organizations who have come together behind Advance, which is one of the strongest national collaborations that we've seen in gay, bi, trans, two-spirit, and queer men's health in this country, and one that actually extends far beyond MTV or Montreal, Toronto, and Vancouver. And lastly, I just want to review some of Advance's programming priorities, our next steps, and some of the challenges that we already know that we have to contend with in our effort to ensure that the work that we're doing in this project is impactful and valuable. And also just to help contextualize some of the local and regional work that my colleagues in the project are going to be talking about. So as I mentioned, I moved to Toronto about 3 years ago to take a job with Katie as their knowledge broker for gay men's sexual health. But what really motivated me for this role was to to explicitly explore different opportunities for national collaboration in the sector, particularly among gay, bi, MSM-focused work, as well as the sort of much anticipated and new funding model that was coming out from PHAC. So one of my first tasks was to organize a satellite meeting at the Katy Forum that year, and that just basically brought together different community, public health, and research stakeholders in Canada. It was only a one-day meeting, but it was a significant meeting, and one thing that emerged from that was a set of priorities for enhancing collaboration in the sector. And there were essentially 4 priority areas: research and knowledge translation and exchange, policy development and advocacy, network development, and of course funding. And I think the funding opportunity that everyone was really excited about was this new Community Action Fund that was about to be released. So one of the things that made this funding opportunity unique was that it specifically included an invitation to collaborate between organizations with shared interests, so be it by population or geography. Those, I think, were sort of interesting ideas, and it was a new opportunity for different groups who had the shared interest to work with gay men, but across the country. So so while some in the room may be aware that we didn't actually get it right the first time, what emerged out of a long process of proposal development and redevelopment was this Pan-Canadian coalition of by and for gay men's organizations and community-based organizations. And those organizations are Health Initiative for Men, ACT, formerly known as AIDS Community of Toronto, Max Ottawa, Réseau in Montreal, and of course CBRC, which plays dual roles in this alliance as the national coordinator, but also the leads for the Prairie and Atlantic regions. So I have an asterisk next to Pan-Canadian because while the project includes resources and implementation for at least some activities in all 10 provinces, it doesn't currently include the North, but we do acknowledge that as being an important limitation in calling ourselves Pan-Canadian. So I'm just gonna skip down. So it was a long process, but after many months of negotiations, we finally got our 5-year contribution agreements in place back in March. And that allowed us to work to get the team established as well as the core project mechanism. So that was primarily things around governance and communications and getting our community alliance branded. So and that process had led us to Advance, our new name, with the taglines "Our Health, Our Wellness." And if you check out our website, www.advance-avance.ca, you'll see the website and more information about the project. So, as I mentioned, Advance is an alliance of 5 leading community-based organizations dedicated to LGBTQ in Canada. Unlike HIM, ACT, and MAX, and Réseau, which primarily operate locally, CBRC is represented in 3 different spots in this map to reflect its distinct roles in the Prairie and Atlantic regions, as well as a national coordination role, which is primarily delivered by myself, Jose, and Len Tooley, who is the evaluation manager for the Alliance. I'm not going to go through the full list of the different staff that are supporting the organization, supporting the Alliance at each of the organizations, as my co-presenters will be speaking to that level of detail. But I think it's important to just recognize that one of the most exciting aspects of the Alliance is the fact that we are able to hire several dedicated full-time coordinators and managers across this country. In addition to that, there's a significant number of contract support personnel that allow us to sort of extend the work that's happening in the primary sites of implementation. So I don't. I know I'm already running out of time. So all of this information around the vision, the mission, and values of Advance are on our website. So I'd encourage everyone to have a look to check it out. But I think it's important to particularly pay attention to like the values that underpin this alliance. As well as just our overall vision of having a comprehensive, responsive, and equitable health system that meets the broader health needs of our community. I'll just quickly mention a few of our pan-Canadian or national Advance priorities. So that includes policy development and education work, which one thing that we'll be starting tomorrow actually is a national consultation series with policy and practice leaders to explore challenges, opportunities, and priorities to optimize combination prevention services and linkage to care. And then another sort of core activity is around knowledge mobilization and some of the work that's really sort of integrated with the work in SexNow and really making sure that the data that comes out of that reaches sort of the desks of different policy makers, decision makers, service providers, and other stakeholders in the system. And of course, one of the things that my colleagues will be speaking to is different activities and ideas around intervention development. So I just want to quickly mention some challenges and next steps. So Canada is a big country, and I think we all recognize that. Our current core alliance group includes 5 organizations, but I think right from the beginning we recognized sort of a need to broaden what the organizations that we are working with, and to try and consider the inclusion of territories. The other thing that needs to be recognized is that we do need to expand work in some less resourced areas, so particularly thinking about the work that's happening in the Atlantic and the prairies, and the kind of smaller scale of activities that we are able to do, but recognizing that this project itself is a big step forward. Also, trying to make sure that we are meaningfully engaging and representing the diversity of our communities, so Indigenous and Two-Spirit people, as well as trans men and women, newcomers and refugees, people with disabilities, non-binary folk, and of course, people living with HIV and/or hepatitis C. And lastly, we just really want to make sure that we are building a truly collective, multi-sectoral response. And if we're not able to get the buy-in from local and provincial policy and decision makers, as well as new partnerships across the health system, it's going to be really challenging to have the impact that we want to have. And my last slide, just thank you for coming out to our panel today. Please check out our website. You'll find a series of articles and blog posts from each of the Alliance member organizations, just sharing some information about what we've been up to, including local community consultations, PrEP advocacy, and of course SexNow, which the Alliance was heavily involved in. And don't forget to like us on Facebook and follow us on Twitter. Thank you.